Have you done much interviewing in the past, just so I can kind of gauge my expectations to your level of experience?
I've done some interviewing in my internships and in a couple of jobs, but it's not to any degree that I feel competent.
So it's not extensive. You haven't had a lot of extensive experience. So you have seen somebody, a client at your agency, and was it the first contact that you've had with this individual?
Yes, this was my initial kind of assessment where I used my agency kind of question.
And let's give the individual a pseudonym.
We'll call him Sam. I just made that up.
Okay, so Sam, tell me just a little bit about how that first interview went for you.
Sam didn't seem at ease during the interview and appeared to be rushed in answering a long list of my questions that I have to ask from the agency's protocol. And I felt I was interrogating him at some point in terms of his response to me, and how I'm trying to figure how I could make this more fluid and answer all the questions that the agency requires, because that wasn't good for rapport, put it that way.
I see. And how I have not seen the agency protocol, but if you could just briefly describe the number of pages that you're required to submit.
Well, the thing has a lot of checkoffs. It goes on for about 8 or 10 pages. It looks at, the early childhood stuff, the educational stuff, any kind of encounters with the law, substance abuse. It just, it's a complete kind of overview of all aspects of life, pretty much. And but there's so many of them in a limited time. It's like you're shooting questions and not having much time to explore things that may come up that might be more important later on.
I see. And sometimes there are overly extensive or high expectations for initial visits with patients, and it can be very overwhelming, especially for a novice psychiatric interviewer. What kind of time constraints do you have for that first visit?
Well, generally we have about 45 minutes to an hour with clients, and sometimes I like to use that kind of watching the clock.
You mentioned you felt as though you were interrogating the individuals. Can you maybe just start at the beginning of your experience with this individual and tell me how that started with Sam? Start at the beginning and maybe tell me a little bit what you learned.
Well, I felt, I was frustrated because I kept missing important information by rattling off questions. So when we started, we have this thing with the agency about pronouns, which I have real issues about. So I asked him what his preferred pronoun was, and he said, "What in the hell are you talking about? I don't know what a pronoun is." And so he said, "Just call me Sam." And I thought, and this has been my contention all along. Most people don't know what the heck it is. But anyway, I learned that that's probably not what I'm going to use in the future. It doesn't seem to work well. Most people don't know what I'm talking about.
That sort of etiquette sometimes does get in the way of building a relationship, because in most circumstances, you might want to say, how would you like me to refer to you, by your first name or your last name, Mr.? Asking about pronouns might be, something that maybe some people might do, but I think it's kind of intimidating and not quite as important in terms of building rapport, other than saying, very nice to meet you. How shall I refer to you? So does that make sense to you?
Well, I think it makes a lot of sense because, curiously, in a lot of languages, there aren't pronouns per se. And so if you're asking someone that's not a native English speaker and they have a different language that didn't have pronouns, that would also be perhaps confusing. And, we were in school years ago, so who remembers? I had to really kind of think about this when this became the rage of asking people what their pronoun was.
I see.
So this makes more sense. It's more kind of client focused too, isn't it? It's sort of like trying to build more of a subject connection with the client rather than being the interrogator or the one in charge, but sort of a comfortable conversation does make a lot more sense. And it moves things along, I think, more smoothly as we look at other things that were a problem.
I think that it is very important to conceptualize that while the agency may have some goals of accomplishing quite a bit in a short period of time, the important issue is the relationship with the individual, because if you are off-putting, or if you're rushed, or you're madly going through papers and everything is kind of speeded, you're not going to develop much of a relationship with that person. So that perhaps those agency questions, there may be some important ones that you need to ask in terms of demographics and very basic information, but 45 minutes to establish rapport is not a lot of time. So that I would suggest that you be a little bit maybe more conversational in the future with these people, and less intense in terms of rapid fire questions, because it does seem to be an interrogation for some people.
Well, that gets to my second point about with this, because I'm following your list there. So asking questions based on the assessment did not allow for elaboration of the client's life situation. It was question, short answer, next question. But like you say, in conversation, more emerges than just rapid fire questions. So I was really uncomfortable as we got further into this, as I have with other interviews. And so I think this approach sounds a lot more like it may more fluidly flow, and I may get more information from them than I'm expecting that really answers a lot of things on the form that I have to respond to when I do the report.
I think the most important issue at a first session always is to establish, if it is to be continuing, to establish a bond, a rapport with the individual. And I think that approach is a very, very important consideration. And to that extent, to proceed as if you were making an introduction with perhaps a neighbor or someone else you've not met before. And it's going to be not a friendship, because we have to have some separation, but not the distance of filling out the form and the intensity of going through many, many, many questions, so that to ask where they live and their age, and do they have children, are they married, and certainly why they've come today to talk with you. Ultimately, that is the most important information, because in the zeal to get all the boxes checked, you may forget to understand that this is a human enterprise. Okay, so you said you felt a little uncomfortable with the pronoun business, and I'm wondering, you had some question maybe about the elaboration of the life situation of this individual. What were your thoughts about the life situation of this individual?
Well, the referral had to do with substance abuse. But as you were talking, I'm thinking that it may be easier if I just ask open-ended kinds of stuff, like, can you tell me a bit about your childhood and how you got to today, or something, to allow them to sort of free range. And I like the idea. That's much better than I've been doing this. And I used to do groups, and we would sometimes do that in groups, and it seems like people were much more forthcoming, but they also, that rapport thing begins to develop because it's more of a give and take rather than someone rapidly asking questions just for information. I'm going to try that in my next interview. And I think that this could be, establishing the rapport kind of thing in terms of therapeutic alliance and more fluid ways of asking, and maybe having some throwaway questions in my mind that I would ask, because there's a lot of things that seem to be similar among different clients. This has been a helpful kind of reflection on how you don't have to use the rapid fire and still get the same information. And as you get through the interview and you realize then you could kind of glance at the list and realize, oh, they didn't talk about this. And so you might say, could you tell me a little bit about whatever period it was and how you did whatever? I think makes more sense. And I think they would feel more in ownership of what's going on as well in their own therapy or whatever it's going to be.
Well, it sounds to me like you are, just to summarize what you're saying to me now, and that is, in an open-ended way, allowing someone to tell their own story
Mm-hmm.
and not to get in the way with such rapid fire information. How do you kind of conceptualize the problems of this individual at this point after meeting with them on one occasion?
Well, there were a number of trauma experiences in childhood, from what I could figure. We didn't get much into those, but he did point out sometimes, particularly with the severe discipline of the father, he had, I believe, he had potentially a head injury at one point in his adolescence. Relationship with the family and him beginning to use substances at a young age. Alcohol, but also other substances, was something that's been kind of. He's like in his late 20s now, so this is not something new, and it's been sort of pattern, which sometimes becomes more challenging to work with. But definitely there's a substance use disorder, but I think that there's some PTSD, and I'd like to try to figure out. I have some rapid assessment instruments that look at trauma, which I'm thinking of using in the next session.
Can those be filled out outside of your presence, or is that something that you would have to question him about?
I think it would be better if we question, because again, it's building further rapport with him by pointing out that you mentioned some things last week about the discipline, and it said did you have any issues after you had the head trauma that you were talking about? So trying to ferret out more detail and then figuring out where that fits in terms of the overall diagnostic impression that's developed.
You mentioned that there may have been some head trauma, so that has not been confirmed. Ed, he didn't.
No, we didn't. We just it was sort of the laundry list, like what are your medical conditions, sort of thing. And so I think
he was hit in the head. He was hit in the head.
Yeah, his father on a couple of occasions in adolescence hit him with a like a 2x4 in one case when he was angry with him.
But one important issue with regard, again, to kind of teasing out the issue of perhaps neurological damage, is to ask if he had a blackout at that time, or if he became unconscious for any period of time shortly after the blow to his head, or the number of blows to the head. And certainly if he became unconscious, that is a significant issue in that sort of workup, and would be important to maybe someone medically working.
Right. Well, and having worked in head injury for a while, there's also the issue of seizures, which suggests perhaps a fractured skull at some point.
Yes.
Which ensued after, and it may not have been picked up by the medical people. And so, I think I have to really get into this. And if it's indeed something to this degree, if he hasn't had a neurological kind of evaluation, which in a lot of places people haven't, it might be something to pursue.
Oftentimes these kinds of things go hand in glove with post-traumatic phenomenological stressors. And so you've talked about the post-trauma. Were there some mood symptoms or other symptoms or behavioral?
Well, he talks, in our discussion in a couple of situations, it seems that there'd be some sort of perhaps bipolar mood kind of thing going on, and that sometimes he said in his life he's gone long periods of time without sleeping much, maybe an hour or less a night, and feeling really up, and then, crashing when he uses certain things, because he feels out of control and trying to get balanced. So I think that may be what I would call a provisional. I have to do some more ferreting out, but I think that somewhere in that range, he has something going on. And apparently he hasn't had any medication, psych medication, from what I can tell, to the present time, and I don't think it's ever been addressed.
Did he deny that he'd ever been treated?
Yeah, he said that he hadn't received or didn't take medication for, because when I asked him what his previous diagnoses were, he didn't really have much to share.
Despite your not, I don't know how much of your agency survey you got through after that session, but for 45 minutes, I think you did a reasonably good job. If you were able to say, well, there are some things I yet need to sort out about brain injury. It sounds like maybe he was traumatized, psychiatrically traumatized by the relationship or violence with his father, maybe some other persons too, and that maybe there is a mood disorder present. Now, that's quite a bit for an initial interview, and that with experience, you will learn that, that's a pretty good start. Now, you want to make some provisional, if you're forced to give a diagnosis, there are certain provisional diagnoses, possible bipolar disorder, possible with fuller explication.
That's what I did, because I figure, in the classes I took with the DSM, to figure out that whether or not he meets the criteria for a particular disorder. So I've got symptoms that I've clustered together to further explore next week, because I don't have enough for a clean diagnosis on anything specific from what I was playing with. So I think I need to go back with some more kind of questions to flesh out, does this actually meet the criteria for a particular type, perhaps, of a bipolar diagnosis? And indeed, whether he completely meets the criteria for the PTSD, and so that's the other thing I wanted to work with you on. It's how I become more elegant in how to cluster and fit to the DSM and then to diagnose. And so that's another goal I'm hoping to initially begin to work on.
I think that is an important goal, but I think it's also important to remember that that's not the only goal. And really the most important goal is to help this person.
Right.
And certainly one of the avenues is to know what's wrong with them, but also, the use of your therapeutic skills to help change some of these things. So you are proceeding really on I think, a reasonably good course. And my only suggestion would be to slow it down and to talk with him, as a person, and not be so quick and so eager to make your check boxes on these agency forms. And I think these days they're calling some of that deliberate practice.
Right.
Maybe you're more familiar with those concepts than I am, but.
Well, we talked about, you and I, the deliberate practice piece was my practicing with you outside of the therapy session, develop these competencies and what we were talking about, which I think core building or alliance, the way to interact in terms of the story, and then also, like you say, though, down to figuring out the least severe diagnosis that one can apply to the situation, so that people don't get marked. I've worked with a lot of clients over time who have these horrible diagnoses that I don't know that they ever had, but it marks people for life when medical people or psychiatric look at your record and they, oh yeah, without really going into any detail to figure out what the heck really is going on.
Yeah. What do you think in terms of your evaluation of yourself? What would you see as being the strength of your experience with this individual?
Well, I tried to flex a bit with the questions and answer format with the agency paperwork, which I think I got aware in the middle that this wasn't working as well. But I like our discussion in terms of more of a conversational approach rather than a read off the questions. I think that would be what I gained from this, which is very important because I haven't given it much thought in the past.
And on the other hand, what weakness I think you probably stated thus far is that you rushed initially, that you were so
Right.
eager to get every bit of information that was necessary, that was on the form.
Well, I was trying to answer all the questions, and that caused Sam to become more guarded in terms of what he was going to share. And so I think I may have gained a lot more had I gone with the approach you talked about. So next time I will pick up with doing that sort of relaxed approach, conversational.
I think it's really important to keep in mind that you are, that it is an honor to allow people to reveal themselves to you, and that there are few opportunities in life where we are given the opportunity to freely discuss ourselves
Right.
with someone
Yes.
else, and that to hurry or to pressure with time the situation is really not helpful to the individual. So that I think you're given a real opportunity, and it's a real honor to have the ability to extend yourself to someone else. Anyway, I'm going to we'll continue with this again on our next visit.
I'll try to put together some more specifics about what I want to accomplish with these various, the alliance, the question asking, rapid assessment tools you and I'll talk further about, and then how to arrive at diagnosis. So those are my main things that I want to be working on as we begin to work together over the next few years. So I really appreciate this first session with you from a different angle and see how that goes. So I will look forward to seeing you next week.
You're doing very well. And I think that you identified some real important issues that affects all newcomers to the area. And that is, what shall I ask? How much? And I think sometimes we don't need to ask too much to open people up. They just need the opportunity and the motivation to do that. Anyway, we will see you next week.